Spiky or tacky? I'm sure you've asked yourself that question today, but I wanted to talk a bit about myofascial release tools and some of the advantages or benefits that you might have from using different objects. So what I have right here is a little gumdrop button. You gotta say it, not the gumdrop buttons! It's a half a dome. It's used as a stability or proprioceptive tool. You put down a series of them and typically step from one to the other. It has some spiky protrusions from there, and we're going to use this as a demonstration. And I also have a medicine ball here. It has it's a sand-filled ball inside of it, and it also has this nice tacky grabber surface to it. And we'll talk about the differences, the advantages between using them and when and where you might want to do so. You can always experiment with different tools, but we'll go over this first. So the advantage here is we've got a nice semicircle. We can press this up against the wall. It'll be in a fixed position. I can move my body around it. All these spiky protrusions can go in and add some pressure into different aspects of the muscle. It can be helpful for a pin and stretch and a nice blanket release for a muscle group. We're going to go over the pecs right here. We'll press this into the wall just below shoulder height. Once it's fixed, might even stay there for a moment or so. What it allows us to do is to get into kind of a pin and stretch through that range of motion, and we all have all those little contact points going through the muscle. So just like you might imagine, you might have seen these handheld rollers that massage therapists use, or using multiple fingers or tiger claw to get a release on a muscle at the same time. Spiky apparatus like that might work. So you can use one of these proprioceptive tools or dog toys. Dog toys can be a little hard and spiky sometimes, a little bit too rough. That can be a little intense, but you can try it and it gives you a little bit of a nice release. You can use this for the lower body as well. One of the challenges is because it's fixed, you have to move over it. And if you're sunk into the muscle, you can aggravate the skin and get some abrasions through the tissues if you're not careful. So you've got to use this in an area that's not overly dry or painful, and you have to have good control over it. But for someone who has pretty good core stability and they're an advanced myofascial release practitioner, meaning that they're practicing these techniques on their own fairly frequently, this can be great even for the TFL, for the glutes, or the seated on the hamstrings. Put one of those domes on there and sit on that at a nice angle. Whew, get a nice little release. So here's our other one here. So we had spiky or tacky. Let's come back to tacky. So this isn't just a regular medicine ball. It has that orb that's inside of it that slides around. That's not as important. But what is important for me here is there's some give. It's not one of the hard medicine balls. So if I were to drop this one, it wouldn't bounce back up. It does have some give to it. Now the importance of having this tacky feel to it, it's going to catch the tissue, it's going to let me penetrate a few layers of the connective tissue and then pull or roll away. One of the advantages is to using a spherical object like a ball versus that half dome is I can now move my body and the ball is going to roll with it. So we have the advantage of this tacky surface, but we also have something that's a little bit easier to manipulate. I also have something with a larger diameter, which if someone has restriction in a joint and they can't get through that acute range of motion, like that object forces me into, this might be an easier way to do it. I'll use the right shoulder this time in case you want to turn and talk. But same thing, just below armpit level. You can move around, pin and stretch, get where you want, move the arm away, come across the body. I'm not really talking about acute variables here, such as sets, reps, tempo, specific technique. I'm just talking about the objects themselves. So you can hold sustained direct pressure, you can pin and stretch away, you can make this active, you can use any sort of friction modality, but I want you to get outside or beyond the roller. So beyond the roller, whether you've got something that's tacky, whether you've got something that's spiky, you can get a different release within the tissue, different parts of the body, and you might get a different benefit from it. So if you're an advanced myofascial release practitioner, you have good core stability, good control, you don't have any pathology that would be contraindicated for putting you into a range of motion with an external object pressing into you like this, give this a shot. Use a tennis ball, golf ball, football, try it. Try a football, try a kid's football, and see what release that you get, and see if you can come up with a new way. Hey, might as well even post it here. Come up with a new way to use a household device or a different sports or athletic ball to release a different part of the body. I'm Eric Beard. Thanks for watching. And the question is, tacky or spiky? Thanks for watching. Have a great day.